Hello everyone, I'm Richard Fredericks and welcome again to Profiles, and we're here at Al's Steakhouse, the iconic restaurant of Joliet at Hames and Jefferson, and we have a wonderful guest with us, one of which Dick Schuster has booked for the last 4 months, and I'm finally getting around to having Mary Sheehan on here, and I welcome you, madam. Here
Thank
you go.
you. My pleasure.
Good to see you.
Thank you.
This is a January CEO. She came on in a sled at the hospice, and they welcomed her. All the little dwarfs were all lined up, and Dopey and all those guys were all there.
Yes.
I'm kidding.
And
January and February and March have just been ugly weather-wise months, but you know, you brighten those months up by you coming to the hospice.
Oh, thank you.
And I know before that you were a consultant to them, so they must have said, you know what, this consultant is a good fit for what we need here at Joliet Hospice. You know about Joliet Hospice? You don't? Well, you're going to. We're going to find out more about Mary Sheehan and Joliet Hospice, but first I want to invite you here to Al's Steakhouse. You know, I do this all the time, and many of you have taken up my invitation, so I want a few more to do so. This is a wonderful restaurant, and it's perfect for lunch, whether it's a business lunch or just the two of you, or we've got the whole family together celebrating an anniversary or a birthday. Great place. Evenings, even better. The steak here, you can kind of look over the window and actually see them grilling your steak, and they're charbroiled, and boy, I'll tell you, they're delicious. Fantastic seafood buffet on Friday nights, and the world-famous Sunday buffet, so you can't miss it. Al's Steakhouse, really in the center of Joliet now, because the west side of Joliet is just this side of Keokuk, Iowa, and so we're kind of in the center of Joliet, at Hames and Jefferson. Okay.
Made me hungry now.
Yes, we're almost here. We're almost at noontime. Mary Sheehan, where are you? Are you from Joliet? No, you're not. Tell me.
I'm not.
Where are
I
you
grew up in Riverside.
Riverside. That's the town. If you ever went to Riverside at night, they got these little old pretend street lights,
Yes.
and you go round and round
Round and round.
in those streets.
Yes.
Right?
And they're gas lights.
Gas
And my
lights.
dad used to tell me, come in before the gas light. The lights go on,
Good dad.
but they're always on.
Oh, they're always.
Yes,
No,
so I always
didn't
got
know
in
that.
trouble.
I didn't know that.
Because
Good
I was always late.
I've got
Yeah.
good friends who've
Yeah.
lived out in Riverside, been there on several occasions. It's
Yes.
a beautiful,
It is a
area.
beautiful
Oh my
city.
goodness.
It is.
It's kind of like the cathedral area 100 times over. It's just beautiful.
It
Okay,
is.
enough
It
about
is.
Riverside.
Yes.
So you're born and raised in Riverside.
Yes.
And your education?
Well, my father died when I was young, when I was 11, and so I decided I was going to be a doctor. And you know, I was going to save people. He died suddenly of a heart attack.
Oh.
So, and I went to Loyola University of Chicago. Started.
I've heard of that little
yep,
school. Yes.
Started my pre-med program, and at the end of my freshman year, I got sick. Actually, I had to have surgery. So I was at Loyola Hospital, and I saw the doctor once a day for 2 minutes, and the nurses are the ones that took care of me.
Oh, yeah.
So I decided nursing was where I could really make the most impact. So I changed my major to nursing, met my husband while I was at Loyola, and here I am.
Great.
And we met in a calculus class.
Oh, my God.
I know. I dropped it. He failed it.
And I skipped it.
Yeah, I consider myself the smarter one because I dropped it
I think,
before I failed.
I agree. I absolutely agree.
Yeah, yeah.
Well, we're grateful that you're from Riverside to Joliet, now we're the Joliet area that
Yes.
you live in.
Yeah.
So prior to coming to the Joliet Hospice, where were you before?
Well, when I first became a nurse, I was doing oncology. So I was taking care
Oh.
of cancer patients at Loyola.
Yeah.
And there was one particular patient, a very young man, who was dying of leukemia. And he had 2 little children and a beautiful wife. And he was dying. And we didn't talk about it back then. This is in the early 80s.
Yeah.
So I walked in one morning and he was gone. He had died, gone up to intensive care unit and died. And his children and his wife were left so bereft, they didn't know. So I decided there had to be a better way for people to die. And so internet wasn't really around then, but I
Right.
found hospice. And I went to work at Northwestern Hospice in the city. They had an inpatient hospice unit. So I worked there for many years and then came out to the suburbs and worked home care hospice while I got my master's in nursing. So then I went to what was then Hospice of the North Shore and worked there for 16 years. as many things, taking care of patients all the way up to be CEO. I was there for 16 years, left to open my own consulting practice, and worked with hospices around the country, mostly about quality of care, access to care, making sure that people were taken care of well.
Does that mean you're training staff
Yes,
then?
training
Yeah.
staff, teaching staff, looking at the financial part, looking at the care part. And I had my consulting practice, and I called Dwayne Krieger, the previous,
sure, yeah.
the previous CEO of Joliet Area Community Hospice, and I said, Dwayne, because he had come back as an interim. So I said, Dwayne, you need any help? And he said, well, I just talked to you last week. I said, no, you didn't. Turns out there's another Mary Sheehan,
Oh,
who's also a nurse, who also does consulting.
amazing.
And he had both of our cards under the glass on his desk. So she was too busy, thankfully. So I came and met with Dwayne in August or July, and came in and did like an assessment of the whole operation. Loved the organization from the beginning, loved this community. It's just amazing. This is a hospice built by the community. And I was interim CEO for a while, and then they asked me to be permanent in January.
Yeah,
So
well, congratulations. That's a
thank you.
win-win for both you, the hospice, and the folks who use the hospice.
yeah, it's
I'm going to get into the mission
Yes.
and more into the Joliet Hospice in just a moment. But
Yes.
one of the things you mentioned here, and I want to do it quickly because I'm as old as dirt and I got to do this quickly
While you
before
remember,
I forget
yeah, I
it.
understand.
You, when you were at Loyola, and this young man died of leukemia and the family is bereft, what at Joliet Hospice? I know many of the circumstances and scenarios of the patient or the clients, but I'm not. What happens with the family when someone passes? What is the responsibility or services provided by the Joliet Community Hospice for the family?
It's a great question. So for 13 months following the death of a patient, we have a bereavement team of social workers, masters in counseling, and an art therapist who provide one-on-one counseling, who provide groups. We have a camp coming up for kids this summer. So we are providing support. You know, the thing with grief is you need to talk about it. It's like PTSD. If you don't talk about it, it'll just get worse. So we're trying to get people to acknowledge and get accommodated to the loss. So it's very important. We also offer that to anybody in the community who's had a loss, even if they didn't die in hospice.
Yeah. And that I don't think people know, though.
No,
That's a good point. That it's
yes.
open to.
It's open to anyone at no charge. We do an assessment of your needs and then put a care plan together. Some people love groups, some people like one-on-one, some people just want things in the mail to read.
Right.
So we adapt based on what.
That's wonderful.
It is
It
wonderful.
really is wonderful.
Because there's studies out now that grief impacts people's health.
Sure. Oh, absolutely.
Yeah.
And I don't know about studies, but you know, just experience, and you know that.
Right.
You definitely know that. So we'll do this several times throughout the show, where we'll put the website up there and the phone number is already ringing.
See?
It's already
Somebody
working.
needs us.
It's already working.
Somebody needs
the
us.
website and phone number to Joliet Community Hospice.
The phone number is 815-740-4104. Just ask for help and we'll get you to the right place. Our website is www.joliethospice.org.
Very good. We'll do that a couple of times. Mr. Schuster, if you would do that for us. All right. What is the overall mission, first of all, of the Joliet Community Hospice? What people hear that and say, well, this is what they do.
Right.
So I'm going to ask you for the elevator speech,
Okay?
and then you can
Expand.
take it all the way up to the 40th floor.
Well, the elevator speech is that hospice provides a team of care for patients who are dying in their home, which might be a facility or their residence, and also in our hospice home. It's for patients with a 6-month or less diagnosis who have pain and symptoms or who just need, no one has died before. So everyone needs support to figure out how to get through that process.
That's a good comment. No
Yeah.
one has died
No.
before. You don't get a repeat performance.
No, you don't
on
get a
that.
repeat performance.
Probably get near-death experiences.
True.
You know, but not
Not-
the
Right.
actual.
So no one knows how to
Yeah.
how to maneuver
Yeah.
that, and families don't know how to maneuver that. And
Well,
that's,
it's, the emotion takes over, the sadness takes over. there's anger, there's guilt, there's all the things you can possibly think of.
Yes.
Sometimes all at once,
All
and
at
sometimes
once.
over months and years.
Exactly.
The location, by the way, maybe I should tell you where this is at, because it's probably not a bad idea, and I think it's allowed, to just drive through. You don't have to go in necessarily. I think you need to call for an appointment for that, right?
Well, not necessarily. You could just drop in, and we have always people who will.
Do you?
who-
Okay.
Absolutely.
Beautiful
Absolutely.
grounds, however, and speaking of that, coming up, I hope this, are we going to be on the air early enough for this? June, when is it? Your
25th, the garden,
yeah.
Timmy's Garden Walk.
We'll be on before that, so we'll let folks know about the garden walk.
Okay, so on June 25th, some of the best gardens in Joliet, one of our families who had a loss sponsors a garden walk. So it's a fundraiser for us, but you also get to walk around and see the beautiful gardens of our community.
Yeah.
It's it's going to be a beautiful day.
How many are in?
I don't know that.
Well, there'll be a bunch of them. I heard, I think, was it you or you were on the WJOL? Or?
No, that was Jackie.
Okay, Jackie was talking about that,
Yeah.
and that's who I met. She was at the Corvette show.
Yes, she was.
Okay,
Yes,
I
she
knew
was.
I had somebody from Joliet Hospice.
Jackie Persanos.
Kim, I thought you looked a little bit like her. That's why I thought it was
Yeah.
Jackie, and that was put on by Hawk Cadillac, and we had like, I don't know, 50 or 60 Corvettes from 1957 on up, and Jackie was taking $5 here or there.
Yep,
People
they
were coming
raised
to
they
do it.
raised over $3,000 for us. that day.
Unbelievable. On the most ugly, cold, miserable
Yes, it was
Saturday you
an
could
ug- it was-
possibly
it
choose.
was.
And next year is going to be even
When they brought the
better.
check, though, it was a beautiful day.
I'll bet it was a beautiful day.
So I got to stand
Thank
out
you,
there.
John Crane, by the way, owner of Hawk Auto. Great guy, good family. You know, it's interesting that the Bill Jacobs family had owned that for so many years, and now the Crane family takes it over, and they're going to be just like the Jacobs, giving and wonderful folks. And Jim Mazinga, general manager out there, was great. Cindy McCorkle, all those wonderful people. So the process, kind of walk me through that. So are you contacted by phone, or is a minister call, a priest call, a funeral director? How does that work?
The answer is yes.
Okay, all right.
Anybody can call and make a referral for hospice. One of the myths about hospice is that it's really a short, you call us when you're really at the end, and we would actually like to provide service and support earlier in your disease. So your doctor could call, you can call, we've had neighbors call, priests call, we've had housekeepers call, we've had mailmen call when somebody didn't
sure.
answer the door.
Yeah.
So anybody can make a referral to hospice. Our job then is to contact the patient and the doctor and
Yeah.
get permission.
So are there other agencies involved that would make a call or would be associated with you in these times?
Yes, our biggest referral sources are our hospital partners, Silver Cross, St. Joe's, Morris, Bolingbrook,
Okay.
and then all of the nursing homes that
Yeah.
that we surround
Yeah,
by.
and there's more of those, and
Yes.
and the increase as the baby boomers age, assisted living, and all those categories are
Right.
increasing,
Right.
which is another one. We've got a long list of people to talk to, and we finally get around all of them. But that's another category, Mr. Schuster, that we should be talking to, folks in the assisted living industry. I have down here something that I don't understand. What is this ballroom? What is ballroom dancing? What do you got? What do you got?
Well, my husband and I, about 3.5 years ago, my boys graduated college and left. No more tuition bills. So we decided to start ballroom dancing lessons.
Okay.
And now we compete nationally with amateurs, but all through the Arthur Murray.
Yeah, I saw that movie.
Isn't it a
With,
great movie? Yes.
who was that with?
Richard Gere, that one?
Richard Gere.
Yes.
I've seen it twice. Once
Yeah.
in the theater and then
Yeah.
at home. My wife and I then watched it.
Yeah, it's really like that.
I didn't think it was going to be a good movie. I thought this is a chick flick that she's taking me to, but it really, I liked it.
Yeah.
I really did like it. So that's what you do?
Yeah, we get on the floor with all these couples and they, tap you on the shoulder kind of thing. And
That would be a fundraiser. Let me get this
Oh,
for
yeah.
you here. Let me just do
yeah.
that'd
I'm
be a-
hoping I can do the local Dancing with the Stars
Well,
some year, yeah.
Here you go right now, You've got the phone number to the hospice, so get to
Yeah,
to
call me.
Mary,
I'll
and,
dance.
They're always looking for couples to do that.
Yeah.
That'd be great. Then there's something else here, and then we're going to get back to the hospice. And I guess my question would be, did you become what I'm going to ask you like 2 weeks ago or something? Because it says down here that you are a Cub fanatic.
I am. No, it's not just been the last 2 weeks.
Okay.
My husband grew up on the south side of Chicago.
Oh my goodness.
But he's still a Cubs fan. So I have 2 boys, and so in order to, bond with the men of the
Yes.
family, I decided to go to baseball games. So we've been going for many years. We're season ticket holders now. We have been for about 5 years.
Wow.
And now I'm kind of into it.
Well, prior to this year, and maybe a little bit last year, those first 3 years, you actually needed to be canonized for going to Wrigley Field and
That's
watching
true.
those guys.
In the cold and snow, yeah.
Unbelievable. Well, they're great, and it's great to know you're a
It's
Cub
fun.
fan. You know, of course, that half of Joliet is from
I
the
know.
south side of
I know.
in the south suburbs.
I know.
And they're all Sox fans.
No one at Joliet Area Community Hospice, though, will admit that now.
Oh, yeah, right
Yeah.
now, sure. Oh,
I'm
yeah,
putting it
we,
on their performance
We're in
reviews.
the Ariana
Yeah.
now. We've backed in for years, yeah, well. So what is the cost? Is there a cost, at different levels of cost for this?
One of the best kept secrets about Medicare and Medicaid is that it's all covered. All of hospice is covered by Medicare, Medicaid, insurance companies. The even better news is, though, that even if you don't have any payment source, we will take care of you.
Okay.
That's part of our mission as a not-for-profit hospice is regardless of your ability to pay, we will provide the same care and services that you get.
Truly a non-for-profit. There are a lot of people out with non-for-profit that, you have to kind of question, but this is non-for-profit. So that leads me into my next question. We talked about the garden walk, but what are some of the events, activities you have throughout the year? Because you got staff. These people are not, and they're wonderful, and we'll talk about the staff in a minute, but this is not a corporal work of mercy.
No.
They need to have a paycheck.
They do.
So how do you generate revenue?
Well, our biggest source of revenue is Medicare and Medicaid. So we have about a $12 million annual budget. 11 million of it comes from Medicare, Medicaid, and then we raise money for the rest. So we have our annual dinner was just in April. We have events throughout the year. We have the garden walk. We just had a 5K last couple weeks. So every couple months, we have a golf tournament on August 9th. So every couple months, we have another event to raise money through either sponsorship or participation.
Yeah, great.
Yeah.
Great, very good.
And then the money allows us to do above and beyond what another hospice might do, like that community bereavement.
Right.
Since we don't get reimbursed for that, the dollars
do
of
it.
support go for those kind of things.
The funeral directors, I don't know how successful this is, but the funeral directors have what's called a pre-funeral package or a pre-funeral time to go in there and talk about it.
Right.
Is there such a program in terms of, let's say everybody's healthy, you're 55 years old, you're 45, you're 62, you're 75, whatever, everything's going fine. But we're all going to go. I mean, there's no
The
other
baby
way.
boomers don't think so.
Yeah, well,
But, yeah.
you are, and
Yes.
I am.
Yes, we all are.
Is there a program or something that we can knock on the door and go in and talk to somebody, or can you put together some little seminar for folks and talk about stuff like this?
Absolutely. One of the key things for hospice and for all of you is to really make sure you've had those conversations about what your wishes are. So they're called advance directives. So you need to really have conversations with your loved ones about, here's what I want. So we do lots of that kind of education in terms of, here's the actual pieces of paper to complete, and here's how to have the conversation. It's not, have you heard the death cafes? There's actually things popping up where people are meeting to talk about death and dying and what their wishes are. Because once the crisis happens, it's too late. It's too hard to have the conversation.
Well, there's all kinds of, not only the hospice end of it. I'll share this, that my father passed away. My father was not a guy who went to church a lot, and he did not want to have a church funeral. While my sister, who was in charge, we had this huge church funeral and all this kind of stuff going on, and you know, my mother knew that this was not my father's wishes, but she was, you know, she wasn't going to be making any decisions. And I don't blame my sister. I mean, she did the very best she can. And,
Right, absolutely.
and she was in charge. It wasn't me. But those things kind of happen.
They do.
So here's something that I'm going to do, maybe you should do, is kind of write down some instructions for people. You know, this is what you'd like to have, even to your obituary. And you can copy it, open up the Herald News and say, well, no, this is kind of the way I want to do it, or this is not the way I want to do it, or go over to see Fred C. Dames or TZAC, and they've got advice, they've got programs for you. So.
They do. And there's a document called 5 Wishes. So 5 Wishes, if you Google that, you'll find an actual document that'll lead you through the questions to ask.
Perfect.
And then some people, I had one patient who put it in the Bible.
Yeah.
So that's, as she told our kids, it's in the Bible.
Yeah.
That's where you go when it's time for you to find my instructions.
Perfect. What I do, I know you've just joined us. Okay. What we're going to do is going to summarize what Mary Sheehan's been talking about here for the last 20 minutes or so, but you just clicked us on. So if you could just do a brief summary, we'll start out with the mission, location, and programs that you have, and then I'm going to conclude with the staff and volunteers.
Okay, all right. So Joliet Area Community Hospice has been around since 1982. And our mission is comprehensive care for our community at the end of life or when they're diagnosed with life-threatening, life-challenging illnesses. Hospice is our major program, and we bring the care to you in your home or facility or at hospital, and we provide education, support, pain and symptom management. The other wonderful thing that Joliet Area Community Hospice has is a hospice home, which is a 16-bed hospice on our beautiful property, which is 250 Waterstone Circle in Joliet. And it's a place for patients to come if they can't be at home any longer. Their pain is too bad or whatever might be going on, we can care for them there. And we're the first in Illinois, and we're the only freestanding nonprofit that has this beautiful place. So it's a wonderful place.
Even the for-profit ones, there's not that many of those around either. Many of the experiences people have are the hospice coming to your home.
Right.
You know, you have the hospital bed now is in the living room or the dining room or, you know, someplace like that.
Right.
And that's a great, wonderful, caring, compassionate service as well.
It is. The biggest thing for people at the end of life is anxiety, fear about what do I expect, what do I do, and we can provide that education, the normalizing it.
Yeah.
Because you're right, we're all going to die, and we only do it one time.
I don't think this is macabre. You know well enough we need to talk about some of these issues.
Yeah, we do.
What about this great staff you have? You have Kim over here, and she's doing wonderful things.
She is.
Tell me about your staff.
We have 150 employees.
Wow.
Yeah.
I did not realize that.
We've grown, since I've been there, we've grown about 50%.
Wow.
So it's wonderful that we're able to take care of more patients.
Yeah.
So we have physicians, nurses, social workers, chaplains, nurses' aides, clerks. I always forget somebody on the team, music therapists, art therapists, and we all are on a team to care for a patient together. We also have 250 volunteers who are providing either bedside support, vigil care, companionship, or we have a group that makes bears for us. We have a group that runs the front desk for us. They help us with all of our events. We just had a Memorial Day veterans honoring on Tuesday morning, so the volunteers are the ones that help us staff that. So altogether, there's 400 of us out there.
That is truly amazing. I had no idea. Staff and volunteers, 400. They're not there all one time, obviously.
Well, no, but they're all working in probably about the same time in the community. They're out in patients' homes.
Right.
And,
what is the geographic area that you cover?
We cover Will, Kendall, Grundy, Cook, DuPage, Kankakee. Did I say Grundy? Yeah.
Yeah.
We cover.
LaSalle, not LaSalle?
Not yet.
Yeah.
I'm thinking about adding LaSalle.
Yeah,
No.
and then that's just a hop, skip, and jump away.
Yeah.
That's amazing. I didn't realize you covered that much.
We do. And you know what? Even if we don't go to someplace, call us,
Yeah.
and we'll help you find a good program.
Right. Yeah.
Yeah.
Because this will go up on YouTube, and everyone can see it, not beyond Channel 6 area of broadcast. I cannot tell you how privileged I am to have you on the show, and proud I am of Joliet Community Hospice and you folks who support the hospice. And is there a way that the viewers can, in one way, shape, or form, assist and support you?
The biggest way really is to talk about hospice, to talk about us, to have people call us if they need anything, because we don't want to wait till it's so late that we can't really help. So my number one plea is not be afraid to talk about death and dying and illness. Call us if you'd love to volunteer. We'd love to have more. We always want more volunteers. We're looking for staff. We need more nurses. We need more social workers. We need everything. So if you are looking for a job, call us.
This is graduation time. If your boy or girl undecided and kind of have a pretty well, they're smart. Okay, think about going into nursing.
Yes.
I spent 2 months in the hospital, and I will tell you that the nurses, thank you. Yeah, doctors, thank you, but like you say, they're in for 2 minutes.
Right.
But the nurses are there, the CNAs are also unsung heroes, and we love you all, but that's a great career path.
It is.
And there's going to be need for nurses from now till the end.
Forever.
So great career. Think about it. Mary Sheehan, thank you so much.
Oh, you're very welcome. Thank you for having me.
From Joliet Community Hospice, and from yours truly. We'll see you next time right here on, what are we on? Channel 6, JCTV, Community Television. See you next time. Take care.
Thank you.